Some say it is a silent killer, while others will consider any news of having cancer as a death sentence. Any form of cancer can be deadly if not detected early enough, but breast cancer is one form of cancer that can be treated. I took time to visit 46-year-old Tina Zimba of Lusaka's Kablonga area. She has suffered from breast cancer and now lives to tell a survival story, which started in 2009. A single mother of 4, Tina passionately shares her experience with breast cancer.
In March of 2010, I was diagnosed with breast cancer. And it was very hard for me. When it was recommended by my surgeon that I have total removal of my breast, I agreed almost immediately. The following month, I had the surgery to remove my breasts as well as some lymph nodes.
Tina is among the over 800 breast cancer patients in the country that have braved through to seek treatment at the Cancer Diseases Hospital in Lusaka. Here, over 8,000 patients with different types of cancers have come through to be treated from the time the hospital was opened in 2006. The chemotherapy suite is a busy place. These patients come from different parts of Zambia. Kemeli Banda is a breast cancer patient from Liteta. This is a third chemotherapy treatment.
Nichitako na encourage wanzanga kuti ukamvera chabe kubele osayopa ma doctors bali ku UTH basebenzerapo maningi apa inenili chabe bwino.
Jenny Astwala from Chirundu is having a 6th and last chemo treatment. The side effects of this treatment are harsh. Jenny lost her hair just after the first chemo treatment.
Kanamba kamera kakotwa hapa, then kaja kakotwa wanabora wakajuba. After wakajuba, ndio kumene kanamba manje kubaba manje kubabilatu. Nabora bankala mkosu muvonse bimashita bifuta bifuta. So mimi nafika ku Chirundu nanuza tamanga cha bende ku Lusaka. Baza kukonza bino vonse bivisile. So ndio mimi nabora kuno ku Lusaka utugamba nichita chitema amba nipasa mankwala yakukimu kwa mene kuno. So manje nivela kasako.
It is side effects such as these that tend to make some women opt out of treatment for breast cancer. The hospital administration shares some of these challenges.
The major side effects are its effect on the blood forming marrow. Normally it suppresses that, where someone ends up having anemia, that is a low hemoglobin level or low HB. I think people are familiar with the term HB anemia. Low white cells. Now white cells in the body are the type of cells that help us fight infections. So if those go low, sometimes someone is prone to infections. And there are times when you have to delay chemotherapy based on the fact that someone has got low white cells, and you support them with some other drugs to improve that.
As she continues to share a breast cancer story, Tina is mindful that not all patients will be brave enough to complete their treatment. The treatment, which involves surgery, then chemotherapy for about 6 months, and then 6 weeks of radiotherapy, is life-changing. Among the side effects that Tina has to live with as she embarks on a journey of taking medication for 5 years to inhibit the cancer hormones is the swelling of her left arm. This she attributes to abnormal flow of fluids, which causes more of a discomfort than pain.
During the chemotherapy treatment, I underwent difficult physical changes like losing my hair, my skin becoming darker, my nails and my tongue turning black, as well as constant nausea. My lymph system has been compromised by the surgery, so what is happening is that the fluids are not flowing as they should in my arm, so the fluid accumulates and my arm swells.
For Tina, the road to recovery also comes with support from her 4 children and friends, but most of all, she urges women to go for breast cancer screening.
Everybody who feels a little twinge, a little lump, even when it's not a lump, they'll tell me, come and check. You know, everybody thinks you have the you have the answer now. But at least I think it's made us all aware as a family that this disease does exist and it can strike.
And as the world observes Breast Cancer Month this October, Tina says no life should be lost to breast cancer. Ruth Kamwi, TV2 News in Lusaka.